What are some general recommendations that you can make to reduce inflammation? And some of these can be dietary, some like anywhere you want to go with this. And what are some typical recommendations that you typically give some of your clients?
I already talked about the glycine and B6.
Yes,
That's really important. That's step 1. I tell
agreed.
that to so many clients. I'm like, "Just do it.
Yeah,
Do it if you're not even a client, like, just get started on that."
just be prophylactic with it. Take a little
Yes,
glycine. Yeah,
it's not gonna hurt you.
yeah.
The second thing I would say is to start taking stock of all of the symptoms that you have. The one big mistake that a lot of people with skin rashes make is they fixate on the skin. They
Mm,
also fixate on their condition, and so if you're looking at what are my inflammatory triggers, we need to look at the body's symptoms as almost like a treasure map to help us figure that out. And so a lot of times, like people say, I'll go, "What are your main concerns?" "Eczema." I'm like, "Okay, what else is
yeah.
going on?" "Well, I have itchiness and
You're
like
like
2 other things."
now you're describing the eczema.
Right, and I'm
Yeah,
like,
yeah.
"Okay, but like, how many times a day do you poop?
Hmm.
Are you having any other dysfunction? Do you have headaches? Do you have tingling in your hands and feet?" Like, I'm looking for others, and they're like, "But that's not important. It's not about my skin." And I'm like, "It doesn't matter because inflammation can and stress, I mean, the internal stress that nutrient depletions and what's going on in the liver, what's going on in the GI tract, that stress is not something you can just, like, check out on. You can't like punch the clock and walk away from it. It is with
Yeah.
you all the time.
You can't
And
have a
even
toxic job and hate your
right,
husband and,
right.
have mold in your house and not deal with those things, right? Yeah.
Exactly. And it's
Yeah.
also difficult. You can't walk away from gut infections or
Right.
some sort of dysbiosis.
Yeah.
So, I like to have people check their stomach acid. That's really important. A lot of people do not have sufficient stomach acid. So, that's one area that we tend to evaluate. And you can
I
easily
have
do
to
that on
thank you
your
so
own.
much. I have to
Oh,
thank you so much for saying this. Yes.